Jen, don't worry, we're not going to be here long.
Let me just,
The doctor just needs to do what they need to do.
Oh,
Right.
hi, Eric. Hiya.
Hi, Anne. How you doing?
Hiya. I've got Jenny here.
All right, yeah.
24-year-old
Hey, Jenny. How you doing? You all right?
Sorry, she's been out for coffee
Oh, yeah.
with her friend.
Hello, Anne. Hi.
Hi.
You,
Passed out, really, didn't you? So I'm just
Passed
doing
out?
a set of obs.
Right.
But you're a
Okay.
bit desperate to get away, aren't you?
I need to go home. Am I
Okay.
going to be here long?
Well, Jenny, hi. My name is Dr. Rams. I'm one of the A&E doctors. Just a bit of a chat, really. Just that. So you're. What's your surname, Jenny?
Smith.
Jenny Smith. Right. I'm sorry. Who am I
Johnny
speaking to?
Squires, nice to meet you, Doc.
And a relative or
Good friend.
Good friend. Right. Okay. Fine. So, Jenny, what I'd like you to do is just tell me a bit more about what happened, if that's all right, and we can have a few minutes chat, and then we'll decide where we go with this from here between us.
Well, I'm really hoping I'm not going to be here long
Okay.
because I've got a lot of work on at the minute and I
Lot
need
of
to
work.
get home.
All right.
She's very
for the
busy.
day
Very busy.
tomorrow.
What job is it? What job do you do,
I'm
Jenny?
a solicitor.
Oh, quite stressful. Yeah.
What
Oh,
happened was
yeah.
I was in a coffee shop and I felt a bit dizzy and then sort of fainted, but I didn't fully black out.
Right.
I wasn't down long.
Yeah.
But yeah, felt a bit sick, vomited after I sort of hit the floor.
Right.
I'm feeling alright now.
Vomited after you hit the floor. Yeah. Right. Did you black out completely?
For like a second.
And how long
Oh,
were
it
you?
was longer than that, no. She
For
was on the floor for minutes.
On the floor.
Was she unresponsive at any point?
Oh, no.
Always responsive,
Yeah.
but down for minutes.
Yeah.
Yeah.
I was quite worried
It
about
only
her.
felt like a couple of seconds.
Oh,
3
okay.
max.
I see.
Right. How long is it until she was able to get up and sort of be fully back to
Oh,
herself?
I'd say it was 2 or 3 minutes before you're back on your feet. But
Okay.
you spoke to me the whole
It
time.
wasn't that long.
Spoke to you the whole time.
Yeah.
Do you have any convulsing movements
No.
or anything? Any shaking?
No.
All right. Okay. Before you were going to go down, did you any warnings at all?
No, I had a few heart palpitations.
What do you mean by that?
So I just felt like my heart was beating really fast for a couple of seconds.
Our obs are fine there, Derek.
That's fantastic.
I feel
Now,
all
could you
right
just tell me what they are?
A BP is 110/70, pulse is 64, respiratory rate 14.
Smashing. Thanks, Anne. That's marvellous.
Yeah.
Sorry, you said.
Honestly, I feel fine now. I
Yeah.
don't see any reason why I
Okay.
should be kept here really any
Well,
longer.
Well, of course, you're free to go anytime you want, Jenny. It's very useful for us to exclude anything that could be serious. I think these things turn out to be absolutely fine, but we want to make sure you're just absolutely fine before you go. So a bit of a chat's really helpful.
Right.
It's up to you when you go. But yeah. So, are we alright to ask you a few more questions at all?
If you need to,
Yeah, that's great. Thank you. So, you said you had a bit of fluttering beforehand. You went down for a few minutes,
Mhm.
and you vomited once after. Is that
Once,
right?
yeah.
I'm sorry about that. Has this happened before?
A similar thing happened about a month ago.
Right,
I
about a
was just
month
at
ago.
home.
You didn't tell me that.
Right, about a month ago. Okay, and you were just at home. Were you doing anything at the time particular?
No, I was just sort of sorting the house out, doing a bit of cleaning.
And you just. Did you black out at that point, or was it just like almost like feeling like blacking out? Do you have to
The
lie down or
feeling of
anything?
Blacking out, and I did need to lie down afterwards.
Yeah.
For about an hour, but I
Wow.
felt after that I felt absolutely fine. I just
Okay. Do you have any more of that fluttering at that time?
Before I went down, yeah,
Okay.
a little bit, but not much.
Okay. Have you got any other medical problems, Jenny?
No,
No, nothing at all.
no, nothing. I just found out I'm 15 weeks pregnant, so
Right.
I'm wanting to get back home. My husband doesn't know, and he's going to be wondering where I am today. I've been out for coffee, and I'm now here.
Right.
So as you can see, I really need to get back home.
You need to get. No, I totally understand that, and we will. I'll make this as quick as we can to give you the right information, and anything that we need to do to investigate this and look into it further.
I'm really not worried.
Yeah, I mean, there's a few things there that make me a little bit concerned about just the nature of wanting to black out, like having the palpitations. It lasted quite a long time. You vomited
It's quite
afterwards.
hot in the coffee shop because it'll just be the heat.
I understand, yeah. The other thing is with you being pregnant, have you had any blood tests to see whether you're anemic or anything like that?
Yeah, I don't have anemia or anything.
You don't?
No.
You've had blood tests recently because of the pregnancy, have you? In the
Yeah.
booking. Have you had a booking scan? Yes?
No, not yet.
How many weeks did you say you were? Did you say
15?
15? Right, okay, so that's soon, I'm guessing. Yeah, if you've just found
I've
out.
had a letter through to say
Have
that
you?
I'll be soon,
Good,
so-
yeah. But you said you just found out that you're pregnant.
Yes.
Okay.
Yeah, we've only just found out.
Have you had any, if I may ask, have you had any bleeding down below or anything like that?
No.
Or any kind of show or discharge down below?
No,
Any other illnesses recently? Any feeling of unwell infection or anything like that?
no, nothing
Okay.
like that.
Do you take any medications, drugs, anything like that?
I'm not on any other kind of medication.
Right.
Joe, it's 5 o'clock. You asked me to tell you. I know we need to be getting off, don't we?
Right, well, we'll be as quick as we can. So, sorry, you were talking about any medications?
I'm not on any sort of routine medication or
Right.
anything like that.
Okay, alright, okay. Fine. No allergies?
No.
Take any other drugs at any point at all?
What kind?
Well, any other drugs, anything recreational or anything like that?
Look, I'm really pushed for time, so I need to go, so I am going to be very honest with you here. I do occasionally take cocaine to manage my stress.
Right.
But like I say, I do really need to go. I'm not worried about my situation. I'm not worried about what's happened. I just need to go back to my husband.
Right, okay, understand. Right, well, there's some areas, as I've said, there's some areas of concern. I'm going to have, you press time, I'll go on and examine you in a minute. I just want to have a little listen to your notes. Actually, do you mind if I quickly do that now before we have a quick chat? Is that okay?
Right, okay.
Let's take just a couple of minutes. All right, I'm sorry if you'll push for time. All right. Are you happy enough just sitting now while I do this?
Yeah, it's fine.
Okay, fine. Right, so I'm just going to listen to your heart there. Okay. Deep breath through your mouth, please. And another, please. Through your mouth. And another. Right. Okay. Fine. Okay. You feel any kicking or anything like that at all? I suppose it's quite early, I guess, isn't it? Right. Okay. That sounds and feels all right. I think when, as I said to you, when someone has an episode like this where they're fainting, there's a couple of features with the vomiting, with the palpitations, the fact it's happened more than once, and the fact that you're also pregnant. I think we've got to take that element, just look into that, have a scan, and make sure everything's as it should be with this pregnancy.
Can I just maybe just go now and have the scan another day, or just put it in, or I do really need to go now.
Right.
It's probably
I
5
completely
past 5
understand. We cannot keep you here. You're a perfectly sensible person. You can make your decisions. My job here is to help you understand what your options are. So there's a choice to be made here. We can look at ideally investigating this now, getting you appropriate scans now. Ideally of your heart, we want an ECG trace, which just in fairness takes 5 minutes. I'd like an echocardiogram. I want a full set of bloods. And I want to do get the obstetricians in to do an ultrasound and make sure of this pregnancy.
Well, I'm
These are
already getting an
critically important.
ultrasound done.
I know. Now, ideally we would do that today, but I can't keep you here against your will. So there's some choice, there's some options we've got here. We can do that today, and that's what I really want to do, to keep here. We could arrange these as an urgent outpatient over the next 7 days. That's less ideal.
That would be the
Or
preferable option.
We
for
don't
me.
investigate it at all. But when we think about these syncopes, if there is something potentially serious, and I hope there's not, but it's possible, and we want to exclude and treat it if it is, then we need to investigate it. The sooner is the better. Yeah?
Jen, I know we've got to go, but you've got to think about the baby as well. What do you think?
Do you need a bit of time to make a decision on this?
Yes, please.
Right. Is there anyone else you'd like here to help you make these decisions about your care? Because I think if you come in, I think we would keep you. I think you're likely to be in for 24, 48 hours. And I know you've got critical work to do. Equally,
24 to
we could
48
bring
hours,
you
isn't it?
back this week and expedite this as soon as possible. That tends to be a slightly longer process in terms of expediting investigations, and there are a few things we're going to want.
I'd rather just get going now and do
so
it as an
let's-
outpatient.
As an outpatient, are you saying you want to go home and come back?
Yeah.
Okay, well, we can do that. I'll try. What I think I need to do is just speak to our obstetric colleagues and try and get you into the early pregnancy assessment unit within the next 48 hours. But we need to synchronise that with getting we can get some bloods today, and really I want the medics to have an input in your care, so it's not straightforward. And synchronising that is quite difficult in terms of balancing it, because both those specialists are quite busy.
What do you want to do, Joe?
I'm also maybe there's some other issues here that you guys want to have a little chat about, and maybe should we give you a few minutes and come back? Yeah?
Yeah.
Give you a few minutes, come back in about 10 minutes, and then you
Think
guys
so.
can have a chance to think about working through some of the issues here.
Thank you.
Yeah? Okay. Thanks very much. Right. Should we pop outside?